Hi, welcome back. So we're at the AGL World Summit of Endometriosis. One of my last experts that I'm going to speak with is actually Dr. Ted Lee, fantastic surgeon. Just did some great talks on approaching very complex, deep endometriosis. Ted, why don't you tell us a bit about yourself?
I've been doing endometriosis surgery for, I don't know, at least 20 years now. Let's show off my age, but that's okay. And I've been in a position to train many gynecologic surgeons in the country, including some abroad as well, because I do have a fellow in Lebanon who is now in practice there.
So that's important because fellowships we just talked about with Dr. Gabby Moad, and these are people who've done their residency and then go on and actually spend anywhere from 1 up to 3 years of extra training just to do endometriosis surgery. Is that right?
Right. And I always feel like, I know there's the importance of early diagnosis for endometriosis, and I think that's very important. But once you diagnose endometriosis, then what? You need to have the right surgeon to do the surgery. And I think one of our patients speaker at this conference, one of her slides shows that having the right physician is almost like a lottery prize, something along that line. And I think that's so true. But what we don't want we don't want this to be a lottery prize. We want this to be actual, like, good access for the patients. Right now, what happens is they're very poor access to the expert surgeons, and I think one of the reasons why is that we do not have any kind of coding to describe the procedures that we do. You can spend a few seconds ablating or burning the endometriosis versus 5-6 hours doing deep excision endometriosis involving a lot of bowel and bladder and ureter lesions and so on.
So the common theme here that we're hearing internationally is that even though endometriosis can invade many different parts of the body and take hours of surgical time, that the recognition from insurance companies or payers isn't there.
Right. Well, obviously that a lot of the coding for surgery, it's a very complex process in terms of establishing the codes, and obviously there are a lot of obstacles to overcome. And it is, I'm on the on the coding committee at ACOG, and I have been finding that a lot of challenges to push it through. There are a lot of politics involved. There are a lot of people with conflicting interests involved. So it's been very difficult. But I think for the future of the training, because it's hard for me to teach people all these complex surgeries and to be hypocritical. Say, guess what? None of the things that I'm doing here will be coded. It won't even be recognized by an insurance company. It won't be recognized by your own governing body. So it's very important for all a way for us to document the exact things that we do. Right now, we do not have the language or the codes to document the procedures that we perform. And that ultimately, in the long run, will make it difficult for patient access.
So this is important because this is a totally different part of the discussion, because again, when we think about endometriosis, we're working hard with our patients, we're doing the surgery, but one part of the advocacy piece is to advocate for recognition that this is a very complicated disease that requires sometimes multiple doctors, multiple surgeons, multiple care providers, and that the funding has to be there. So Ted, what would you advise people do out there to make a change? How do we advocate? You said you were part of the ACOG committee, so you're doing it that way, but should we be raising awareness about this disease in any other ways you can think of?
Yeah, I think it's important, I think for the patient to understand that the doctors who are good at what they do, who spend a lot of time helping you, and obviously for patients, this aspect of it is not something typically people are interested in, but my objective is to improve access to the physicians. I don't think patients should pay thousands and thousands of dollars out of pocket to go to a doctor because they don't take insurance. We should make it that it's something that's accessible. For endometriosis should be provided for all.
So this is fantastic, and I come from a universal healthcare system. The problem that we have is we don't have enough experts in this area. Again, the support isn't there. So I think we're saying the same thing. Thank you.